Okay, good afternoon and welcome everyone to today's Haiti Health Network webinar. This is obviously a topic that's very personal to us here at the Dalton Foundation and Relink Medical. It's definitely one that we deal with each and every day, and we're really excited about this topic because I know it affects all of us that have worked in Haiti with the need for equipment and or the situation of getting inappropriate equipment and how it affects our work and how it really affects patient care. And I know that's why the heart behind why we're all here is what can we do to help lower the obstacles to getting good medical equipment and keeping it running and ultimately translating into that patient care. That is the ultimate goal for today. Before we get started, I want to share a little bit about the Haiti Health Network just to make everybody aware of the resources that are available. This is the website that's up. It's just at www.haitihealthnetwork.org, and it is a resource that you can use to get involved with the network and to learn more about activities that are going on. I want to this is one of the resources that is available on the Haiti Health Network website, and it is a facility and service locator for healthcare for all of Haiti. You'll see, I mean, it offers everything from where medical facilities are located. Relevant to today's discussion, it lists the medical equipment providers in Haiti. Which I think is really important because we definitely have Carl Eugene on today. We want to talk about what is available in Haiti and the advantages of working with companies in Haiti whenever possible. So I want to let everyone know that this resource tool is available. You can search through it. You can find organizations, phone numbers, emails. We've got Marie-Claire on the call. She's our new Haiti country coordinator, and she is administering this database, learning it inside and out, and will be helping to keep the resources and data up to date and running all of our programs. So I just want to make sure everyone knows about it. And then the last thing on this piece is just on the website as well. You can join the Haiti Health Network. You can see a calendar of events. You can post your events that your organization is having, which we highly recommend everyone does, because we just really want to create an environment where we can stay connected and informed to be able to provide healthcare in a more efficient manner. So, and the last thing is just another thing we do every week, every Monday night, and many of you are part of it. We do have a coronavirus roundtable discussion. We started it in March, and we haven't missed a Monday yet, where we hear reports from around the country on what they're seeing with COVID, how healthcare providers are responding to the pandemic, and what resources we can pull together to help respond. We've been able to ship down several containers as a result of this networking group. So we invite you to join that as well if it will help your work. All right, so let's get on to why we're here today. We have a great panel for you today and a lot to talk about, and we're gonna do our best to get everything in the 90 minutes. But as I started out saying earlier, we're going to really talk about the common challenges that are seen when it comes to obtaining and maintaining medical equipment in Haiti. We're going to share some very practical tips. After the webinar, there will be a follow-up where we will send you an email with some PDFs of a lot of the things that are shared here today in quick handout form that you can use for your reference. And then we definitely also want to hear, as I mentioned, from the organizations in Haiti to start creating some awareness of what is available in Haiti. And I wanted to real quick send out a quick poll on language. We do have the ability to translate everything today. We have the slides translated as much as possible. And we will be able, I'm going to have Evanel be our first presenter, and he will share in both English and Creole, as much as you can, Evanel, back and forth a little bit. I'm waiting to just hear from it looks like we have about 83% of the people on the webinar that English is a primary language, and about 17% that are Creole. So We know that when we translate, everything takes double the amount of time, but we also want to make sure that everyone can understand. So, and actually, as more people are joining in, it's changing a little bit to 75% English and 25% Creole. So we are getting more and more Creole speakers. So I think we do this just to understand what language is best. So I do think we do want to do quite a bit of translating today in Creole. So before I turn it over to Evanel, Marie-Claire, will you do a quick introduction in Creole, just a few sentences about today, and then we'll translate it over to Evanel?
Sure. Bonjour tout le monde. Moi-même, c'est Marie-Claire. Madame Barbara Kembo sot parler là. Il t'a expliqué Jean l'important pour nous. Jean séminaire ça important pour nous et nous avons un bon petit temps depuis nous planifié pour lui. Et nous pourrons essayer de faire séminaire ça en anglais et en créole. En pile dans deux présentateurs parler créole, il a traduit peut-être yo. Et puis, nous avons partagé quelques informations sur compagnie, sur organisation, qui ça a fait. Can you share the slides, the first slides?
Yes, can you not see my screen?
Not anymore.
Okay.
Not anymore, okay.
Oui, j'aime t'ap dit, Madame Barbara t'a partagé quelques informations sur organisation, qui ça nous fait, qui ressources qui gagnent. Et comme nous parlons avec traduction, nous connaissons que ça prend pile temps, nous pas prêter en pile et n'a retourné à Monsieur Evenel Ozias qui va commencer avec présentation par là. All right. Evenel.
Okay, thank you.
So Barbara, would you please share the screen for me? I can't see the screen.
Yes, I'm switching to your screen right now.
Ready.
Give me just a second to do that.
So in the meantime, so let me just introduce myself while you try to fix the thing on your side. So good morning, everyone. My name is Evenel Ozias. I'm a biomedical equipment technician working for the hospital, BFSS in Pio. And I'm basically a manager also. So my background basically is in administration. So, but I'm currently working for the hospital as a biomedical equipment technician. And I'm going to share with you a presentation about the healthcare technology management. Qui est la gestion de la santé, de la technologie, des soins de santé. And Baba, would you please start scrolling?
Yes,
screen?
you can see my screen?
Yes, easily.
Okay.
Yes. I understand that most of the people do not really speak English. That's why I have my presentation in English, both in English and in French. We talk about, generally I start with this little picture. I know that a lot of people can, remember stuff by seeing a picture instead of words. So that's why I usually start with this picture. If we can look at this thing, it says the healthcare system, which is the système de santé. And this picture looks like this. So in the healthcare system, you got the organization, then you have money coming in. So whenever you have money coming in, you got the human resources to manage with this money. You got the facilities, you got the healthcare technology where we talk about the medical devices, and we got the consumable supplies. And plus you got doctors then to deliver the service that you have to deliver to the people. Donc ça nous explique le système de santé à côté que nous avons système de santé qui est côté nous avons l'argent disponible. Donc une fois nous avons l'argent, c'est que nous avons top management, c'est-à-dire au niveau administration, et puis nous avons ressources humaines, et puis nous avons tout bâtiment, et puis nous avons équipement médical, ensuite et les matériels de consommation que nous devons gérer. Et là nous avons médecins et ensuite nous avons population que nous parlons desservir. Would you please get us the next one? Can you jump to the next slide, Barbara?
Yes.
Yeah, and this one also, we talk about the hospital mission. So which is to improve the health of the community we serve by delivering a broad range of high quality services with sensitivity to the needs of our patient and the family. Donc, dans slide ça, nous parlons de amélioration de soins et au niveau de la communauté, au niveau de la communauté que nous avons servi, et avec nous supposons un gamme de services qui très large, en même qui un gamme de services qui très large, et puis de haute qualité, suivant besoins familiaux. Donc c'est ça mission en l'hôpital ou bien t'as dit un système de santé. Next slide. Next slide, please.
I think it's coming.
Okay.
Oh, it's not happening. Sorry.
Yeah, it's technical, so.
It's like my computer's not responding. I'm sorry.
Yes, thank you. Is it the second slide? Actually, it's the second. The next one. Okay, so the next, so we're talking about the requirement of a technology management program. So, on a parlé de exigence un programme de gestion de technologie. Donc, the first one, I mean, the English would say like the program to control and monitor equipment performance. So, within performance testing, initial inspection, preventive maintenance, and repair. Donc, nous disons que l'exigence qui est pour que nous ayons un système de technologie qui, pour nous avoir un système de technologie qui est correct, il faut que nous un programme qui est capable de monitorer toute performance équipement. Donc, côté nous avons des inspections initiales, nous avons des maintenances préventives et puis nous avons réparation. Donc, dans la réparation, c'est un type de maintenance que nous appelons maintenance corrective. Donc, tout au long, nous avons fait différence entre ça, maintenance préventive avec maintenance corrective. Donc, maintenance préventive, c'est là nous avons c'est maintenance qui est planifiée pour que nous fassions tout équipement pour éviter de tomber en panne. Alors que l'on parle de maintenance corrective, c'est toute réparation ou fait à chaque fois un équipement qui est déjà tombé en panne. En d'autres termes, c'est le service rélo pour faire une réparation. Donc, c'est là nous parler de maintenance corrective. Next one. Next slide. Can you move, Barbara? Okay, so it's gone. So let me try to get it on my cell phone. Okay.
We can't hear you either, Barbara.
Yeah. Technology.
Yeah, can you? I can see your screen, Barbara, but let me go ahead and Barbara, let me presentation. Let me go ahead and get it on my cell phone.
Well, just a second, Evanella. Can you all hear me?
Yes.
Yes. Okay. We'll get it. Is everyone? Give me just a second. I've never had this not respond to my computer before, but maybe. I think we'll be okay. Let's see. I'll go back and share my screen. Okay. Can you see my screen?
Yeah, I can see your screen, yes.
I'm going to leave this version so I can go up and down through the slides because it's not responding. So you want to be on this slide, I assume?
Yeah. So can you go up a little bit? Up?
Up? Sure.
See, so I can.
Which slide would you like?
The third one. After automation. Hospital mission, yes. After this one, yes. After that one.
This one or one more?
One more, right here, right here.
Number
here.
7 or number 8? I'm sorry.
We go down here. Okay, now we talk about inventory control, qui ça, c'est ça le contrôle d'inventaire. Donc nous parlons de tout pour que nous ayons un système pour que nous ayons un système de gestion des technologies qui est efficace. Donc il faut que nous connaissions qui ça nous gagne d'abord avant même que nous parler de gestion avant que nous parlions de management. So we're talking about the inventory control. So basically, the inventory control is basically a complete list of all of items such as property, goods in stock, or contents of building. But for medical equipment, it would be considered as a complete list of medical devices in a hospital or healthcare. Donc, nous parlons de définition pour un inventaire. Un inventaire, pratiquement, c'est d'avoir une liste de tout ça que nous gagnons, okay, en termes de biens, de matériel, etc. Maintenant, dans le niveau équipement médical, nous avons dit un inventaire, c'est d'avoir une liste complète de tout ça nous gagnons comme équipement et dans le niveau de l'hôpital là. Next slide. Et si nous avons considéré l'élément qui gagne dans l'inventaire, et nous avons gagné ça comme exemple, nous avons gagné un ID ou bien ça nous avons un numéro de contrôle. Et pour l'équipement, nous avons gagné description, nous avons gagné fabricant, nous avons gagné numéro de modèle, numéro de série, et puis location, et puis date d'acquisition, et puis qui type de maintenance qui est recommandé pour type d'équipement que nous avons inventorié. So if we look at this slide, we're talking about the equipment inventory. And I'm sharing with you guys, what we need as element into whenever you do whenever you make an inventory. So it'd be like an ID or control number, description, manufacturer, model number, serial number, location. We can use acquisition date and maintenance requirement. So that would be part of it. And if you look at this if you look at this slide carefully, we see the first thing is that we got a code that will identify the medical device. Then we got the device, then we got a sheet, then next we got the printout forms, then we got them entered on the spreadsheet. But we understand that in a clinic, it depends on how many pieces of equipment that you have. So let's say that you got like 50 or 75 pieces of equipment. So basically you can use just an Excel spreadsheet to do the inventory. But if you got more than like 200 or 300, put it like 400, sometimes it might be very difficult to manage. So at that point, we might need the software to do it. Donc ça nous explique dans slide ça, donc nous explique les différents éléments que nous avons utilisés pour faire inventaire de l'équipement. Nous souhaitons expliquer ça tout à l'heure, c'est contrôle number, numéro de contrôle, description, etc. Donc, mais la première chose, c'est que nous avons une identification. Donc, nous considérons un équipement, c'est pour son patient qui vient dans l'hôpital et puis qui gagne un cadre, qui gagne un numéro, qui est capable d'identifier le patient ça à n'importe quelle heure, patient ça venir. Et qu'on soit capable de faire un suivi pour passer ça la prochaine fois, il vient de l'hôpital là. Parce que le patient qui vient dans l'hôpital là, et semaine ça, et puis l'autre semaine, le médecin dit, ouais, c'est pas l'été, ouais, donc il faut un côté qui est capable de documenter, qui permet que il fait un suivi pour passer ça. Donc nous avons un document qui permet de nous enregistrer toutes les données. Et la dernière étape là, c'est un computer qui permet de nous enregistrer toutes les données que nous avons. Donc nous dit que ça va dépendre de grosseur et institution. Donc on a gagné un inventaire qui fait avec, si nous gagnons par exemple 50 à 75 équipements, donc là ça n'a pas besoin d'un software qui pour permettre de faire inventaire. Donc on juste utiliser un fait Excel et puis qui permet de faire inventaire. Mais cependant, si nous avons 300-400 équipements à monitorer, donc ça a nécessité que nous gagnions un système de gestion informatisé qui permet de nous faire suivi tout équipement. Next one. Et nous gagnons un modèle que nous gagnons à Pignon, que nous développons. Donc, nous gagnons Events Axelien qui est en ligne et qui a pas assisté nous là. Monsieur lui-même, c'est un informaticien, donc moi, je fais conception formule, et puis ensemble, nous développons un système informatisé qui permet de faire gestion de tout équipement et à Pignon. Donc, so as I said, we have events actually online, and we have developed a database for Pinion Hospital. So where we have like 170 pieces of equipment inventoried, and in this software we are able to keep track of first our inventory. Second, we are able to generate, a maintenance schedule for all of the 178 pieces of medical equipment. So at least we have a chance for along the year, so that we can see, we can take a look at, we got a chance to look at all of the equipment at the hospital. And this database also will help us to generate the reports for the maintenance. So, and this will keep track of all the maintenance done on a piece of equipment. So let's say, for example, we perform a maintenance on a piece of equipment 2 months ago. So we are able to generate a report to see what was the maintenance done on this piece of equipment, who did it, what was done, how much that was cost, and so forth. Donc, ça nous explique que nous avons un modèle de database que nous développons Pignon. Donc, nous avons M. Vince Axilien qui est un informaticien, et moi-même comme technicien biomédical, donc nous faisons conception formule. Et puis, comme ça, M. Vince lui-même, il programme, il fait conception, nous fait une application qui permet de nous faire gestion de maintenance. Donc, ça permet de nous faire un suivi de l'équipement. Donc, comme ça, c'est un équipement qui est en panne, donc, et nous faisons réparation sur lui. Donc, même si ça a été fait pendant 2-3 mois, donc nous avons remonté sur l'équipement ça pour nous voir qui maintenance qui était fait, qui est-ce qui était fait maintenance, combien ça a été coûté, qui le maintenance ça a été fait, combien de temps ça a été pris, etc. Donc, ça permet de nous un suivi. C'est même exemple nous avons tout à l'heure, donc nous disons, nous considérons l'équipement pour son patient qui est venu à l'hôpital là. Donc, patient est venu à l'hôpital là, il a fait check-up pour lui, prochaine fois il vient, donc il est supposé un dossier que a référé à lui-même qui permet de voir l'évolution patient ça. So next one, Barbara. In this slide, we talk about the inspection program. Dans le slide, ça nous parlait d'un programme d'inspection et nous parlait de maintenance préventive également. Si nous avons remarqué dans le slide, le premier travail que nous faisons un inventaire de tout équipement biomédical que nous gagnons. Une fois nous faisons un inventaire de tout équipement que nous gagnons, donc ça permet que nous gagnions un calendrier de maintenance pour tout équipement. Donc, vous avez remarqué, suivant le slide, nous gagnons mars, janvier, février, mars, c'est-à-dire tout au cours de l'année. Donc, il permet pour dire tel type d'équipement, donc, mais qui le vont faire maintenance là-dedans. Et une fois que j'ai un calendrier, ça, donc, il va permettre que nous gagnions des formes d'inspection qui permettent aussi toutes données à chaque fois que nous maintenance que nous allons faire. Et une fois maintenant ce fin fait, nous allons aller dans un département central, c'est-à-dire nos classeurs qui permettent de classer tout document. So what I'm telling is, when we talk about the management of the inventory, first we got the inventory done. Second, we have the maintenance calendar. Then we have the inspection procedures and forms. Then after performing a maintenance, then we got our centralized biomedical equipment documentation, where we keep all of the documentation. So in case someone else coming and they want to check, or if you are not here, so someone else can take over. Next one. Next slide. And now we're talking about maintenance. And I think this is one of the most important things and for the biomedical equipment, for the biomed thing. It's the maintenance. So we have a lack of maintenance for most of the medical equipment in Haiti. So, and this is not something that this is something that we have to address, and this is something that we have to work together and to fix it. And as I said, for simplicity, the term maintenance is used to cover both the preventive maintenance tasks and the corrective maintenance repair tasks that are required. It is important to maintain all healthcare technology, including medical equipment. Technically, the maintenance involves all action taken to retain material in a serviceable condition or to restore or to serviceability. It includes inspection, testing, servicing, and repair. Donc, ça nous explique dans ce slide, ça nous parlait de maintenance qui c'est un plus gros problème que la majorité de l'hôpital en Haïti que vous rencontrez. Donc, et nous disons, maintenant, ça couvre ça les maintenance préventive et ça les maintenance corrective. Nous avons parlé de maintenance préventive tout au départ. Maintenance préventive, là, c'est toute action que on fait sur l'équipement pour éviter que l'équipement en panne. Alors que maintenance corrective, c'est toute action que on prend les équipements en panne. Par exemple, si on prend pas structure, par exemple, qui est dans le service et puis on les mieux dit pas marcher, ça sont maintenance corrective. Mais cependant, on connaît que m'a gagné un plan de maintenance qui dit chaque mois, je suis obligé de checker toute construction, même si elle marche. Donc, c'est rassurer que vous marchez, que vous fonctionnez pour que les médecins viennent, pour que les médecins aient besoin d'utiliser l'appareil ça pour que les joignent. Donc, c'est ça, nous parler de maintenance. So, next one. Bon. Next. Nous parlons de, we talk about maintenance management. Nous parlons de gestion de maintenance. Donc, c'est vrai, même au niveau de certains hôpitaux qui n'ont pas dit entre parenthèses qui gagnent des gens qui ont fait réparation, c'est vrai que nous réparer tout le temps, mais il n'y a pas bonne gestion qui fait au niveau de maintenance vraiment. Donc, what we say the medical device play a key role in healthcare, vital for diagnosis, therapy, monitoring, rehabilitation, and care. Effective management of this important resource is required to satisfy highly patient care, clinical and financial governance, including minimizing of adverse events. Donc, nous pensons que ça c'est clair à travers tout l'hôpital, la majorité de l'hôpital en Haïti, que si nous avons des techniciens, entre parenthèses, des techniciens qui travaillent au jour le jour, qui fait des maintenances, mais qui, l'aime parler de gestion de maintenance, c'est qui semblait faire appel à lui. On prend un exemple qui est beaucoup plus concret. On dit comme ça, nous avons un hôpital qui a un service d'urgence, et puis nous avons un nébulisateur. Un nébulisateur, c'est un appareil qui permet les pneumonies asthmatiques qui sont capables de faire une nébulisation pour eux. On imagine que dans le service d'urgence, nous avons un petit monde qui a 15 ans et puis qui rentre dans l'urgence à minuit un jour dimanche. Donc, dans ce moment, c'est sûr qu'on va avoir un technicien biomédical qui est là. Donc, on imagine les médecins demandent puis on fait une nébulisation pour petit monde qui a 15 ans qui fait rentrer dans l'urgence. L'infirmière là prend le nébulisateur, là, le plug sur petit monde, il ne va pas marcher. OK? Il ne va pas marcher. Maintenant, 15 minutes après, tout de suite, Timoun n'a mouru. Mais ça qui vient arriver dans l'exemple, ça que nous prenons, Timoun ça, c'était petit directeur général de l'hôpital là. OK? Et puis 15 minutes après, il a regardé dans un tiroir, il a joué notre nébulisateur qui plein poussière, mais qui est fonctionnel. Donc là, nous parlons de problème de management pour maintenance. Parce que si tu as une gestion de maintenance, donc nous apprenons, nous avons 2 équipements, mais qui l'équipement ça doit checker. Et si l'équipement ça en panne, mais côté n'a besoin de backup. Donc c'est ça, c'est là nous voulons arriver pour nous parler de gestion de maintenance. So Bob, I just give an example about let's say that we have an hospital where we have an emergency room. And we have an asthma kid for like 15 years old coming to the emergency room, and the doctor asked the nurse to nebulize this patient of this 15 years old kid, and then this nebulizer is not working, and like 5 minutes later the patient died, and in fact they found out that this a little kid, a 15 years old boy, was the child of the founder of the hospital. And 15 minutes later, they found the nebulizer in a cabinet, very dirty, but working. So now we talk about the lack of management. Mm-hmm. So imagine that at midnight in a Sunday, there is no way that you can reach a biomedical equipment technician in Haiti. Maybe in the US, they might have someone on site that will follow things, but in Haiti, whenever you finish working, you go home. So imagine this is like a kind of lack of management, and that's what I was talking earlier in Creole. So I just wanted you guys to know what I just said in Creole. So can you move to the next one? And I think it would be maybe before the last one, yes. And so for all of that, we have to establish in all of the healthcare system a biomedical service repair. Donc pour que nous bail en solution à tout problème ça yo, nous dit dans chaque hôpital nous t'a supposé un service de biomédical côté que nous fait réparation yo. Donc, si nous regardons l'image là, premier bail nous ouais, et une infirmière ou bien ça un utilisateur de l'équipement, côté équipement nous quoi où, c'est-à-dire l'équipement ça accompagne. Donc, infirmière ça ou bien docteur ça la recueillir information pour dire quel type de problème que machine n'a gain. Deux, li pote demande li faire dans le service biomédical. Service biomédical fait test et puis fait réparation, enregistrer réparation fait et ensuite et à l'enregistrer et faire stockage ou bien faire stockage record dans le classeur que nous avons regardé là. Donc c'est tout un processus. What I'm telling the people is like in each healthcare system we were supposed to have like a biomedical equipment service repair. So where we can have all the user whenever there is a problem happen on a piece of equipment, so they send the request to the biomedical department. The biomedical department get the forms and things and they fix the medical device, register all the data, and then put it in the centralized biomedical equipment documentation as we talked earlier. So next one. And I think even if you could not, okay, that's good. Now we're talking about incoming inspection of biomedical equipment. Donc dans ce slide, ça nous parlait de inspection des équipements qui apportent au niveau de l'institution. Donc nous l'État va recommander que à chaque fois nous gagnons un équipement biomédical qui rentre dans l'institution, que nous gagnons une inspection qui fait pour assurer que l'équipement ça li marche, li correct et comme si il y a sécurité pour que nous capables d'utiliser sous patient. Donc, dans le schéma, nous avons une machine qui vient délivrer l'équipement. OK? Soit l'équipement, ça s'achète, soit c'est prêté, soit c'est troqué équipement, etc. Donc, où elle aller soit dans la clinique engineering ou bien elle aller dans le service biomédical et puis qui fait test sur l'équipement, qui dit que l'équipement ça correct. Nous fait inspection, nous inventorier et puis maintenant, nous stocker documents ça dans classeur. So what I'm telling people, what I'm saying in this slide is like we need to establish an incoming inspection of biomedical equipment where we have the medical device coming, so we got it tested to make sure that it's safe to use on the patient. Then we got the forms to do the inventory and then to make the inspection. Once we know that the equipment is safe to use on the patient, then we can send it to the service and then we keep the forms on our cabinet. And I think this is my last slide, and thank you guys for watching.
Thank you so much, Evanel. This was a great overview of a medical equipment management program and strategy for an institution in Haiti. And I know from being at your facility in person and watching you operate that it is being put in place in real life. So what you're speaking is actually being done, and it's actually working very well, and it's actually improving patient care and saving lives. So we thank you for the work you're doing. For the rest of the webinar, we're going to do it a little bit like a panel discussion. I want to take a moment to introduce everyone that is here today, and we'll try to do a discussion. We will translate some of it as much as we can, probably not 100%, but we will try to walk through some practical examples and share some things today. And we will make sure that all the information that is shared today will be out to the panelists if you need it. Marie-Claire, you want to translate that real fast?
Yes. Merci beaucoup, Yvenel. Toute information que vous avez partagée avec nous, c'est information qui est importante. Vous avez une belle vue de qui sa gestion équipement est. Et pour reste séminaire là, nous pourrons gagner en discussion et reste panélistes à partager des histoires que vous vivez et puis de là nous avons des questions.
Okay, thank you, Marie-Claire. Can you all see my screen? I just want to quickly, I had this up at the beginning, but I do want to do a quick introduction of everyone here. You've got to meet Evanel, who's been just great to work with and doing a wonderful job for advancing the biomedical profession in Haiti. We have David Kuhajda with us as well, who is a biomed that works with us here at Relink Medical and the Dalton Foundation and has extensive experience in Haiti as well. Tom Monahan, I think probably a lot of you know Tom for his great work down in the St. Boniface area, but with the Reparé project in training biomedical technicians in Haiti. He's was living in Haiti doing that for, gosh, 3 to 5 years, if I'm right, Tom, but a long time. We have Carl Eugene with us, who is the president and owner of UGSA Medical, which is a medical equipment company in Port-au-Prince. Who does supply a lot of equipment throughout the island. So we wanted to have that represented as well and create awareness of what he's doing. And then we have Rick Wood on, who's the executive director of Worldwide Biomedical Charities, also on the board, I guess probably the head of the board for TECH, which is the Technical Exchange for Christian Healthcare, which is an organization in the US that is passionate about making sure that the donors, the people in the US, do not send the improper equipment to places like Haiti or other nations. So we want to hear that as well, hear that perspective as well. I'm going to, these next couple slides that I had up were an actual demo visual of the software that Evanel and his colleagues have prepared. For time's sake, I'm going to go past this really quickly, but we want to make sure that you know that this is available.
Oui, nous devons faire une présentation bien rapide de panélistes. Premier monde qui t'a parlé, c'était Evanel Ozias, qui est un biomédical technicien dans Pion. Et nous avons David. David lui-même, il travaille dans Relink Global Health. Lui-même, c'est un technicien tout, mais il fait coordination pour Dalton Foundation. Et c'est un monde qui a peu d'expérience en Haïti dans les affaires équipement médical. Monsieur Tom, c'est un consultant avec une organisation internationale dans Saint-Boniface, l'hôpital, dans Fond des Blancs, qui travaille dans un programme Réparé, un projet en Haïti. Et puis nous avons Carl Eugène, qui est un propriétaire compagnie qui vend médical, qui vend équipement médical. Et puis Monsieur Rick, c'est directeur d'une organisation de charité qui fait don d'équipement médical et puis qui assure tout que équipement qui allait en Haïti ou à quel autre pays qui tant qu'au Haïti que yo ka fonctionner, que c'est pas bagaille nous yo pral voyer et puis qui était chita là pas faire rien. Et puis Madame Barbara a montré nous une image de travail monsieur Evanel t'a fait dans affaires gestion équipement.
Okay, thank you, Marie-Claire, for translating it. I'm going to turn it over to David for a brief second. David put together what we want to do for the rest of the time is we do want to encourage you to ask questions. And I want to have David share a little bit about kind of things to think through when it comes to procuring equipment. And I do kind of want to make this a little bit of a discussion. So as David shares, Tom, Carl, Evanel, Rick, please feel free to add in stories. I do kind of want this to be a little bit of a discussion as well. And then we'll get to some case scenarios where I will have you all to share. And something to think about that I haven't put you guys on the spot, but maybe we'll ask you is kind of one of the stories that you have about medical procurement or working in Haiti that you can share and the lessons learned that we can share with everyone, maybe a follow-up to after David shares. So David, you want to just walk us through quickly these slides and the thought process behind it on what you think through when you're getting ready to procure equipment?
Sure thing. Basically, there's different ways you can get the medical equipment. Could be somebody offers it through donation, you could seek donation, or you can go out and buy it, but there needs to be a basic process and really kind of a procedure that you're going to follow to make sure you're making the best decision. Of course, the first thing you're going to have to ask, is there a clinical need at your facility for that equipment? Most of the time the answer is yes, but in answering that question, things you need to think about and probably write down and document is how many patients have that need. You can pick any time frame. It can be over a month, it can be over a year, because that's going to kind of determine how many pieces of equipment and what your needs for backup are in case the equipment fails, and other answers that you're going to have to do from a maintenance side later on, and as well as keeping supplies in stock. The next major question, now realize when you hit the stop sign, if it's a no, it doesn't mean you stop the process. It means you need to address that question further. If you cannot get that question to a yes by going through making changes, then you do need to stop. But typically the stop sign is it's time to stop at that question until you finish addressing that question, until you have a firm yes answer. Now, the next question, which is a really, really huge one, especially with donated equipment, because it could come from different countries and it may need other utilities that you don't have at the hospital. Will it physically work in the facility? Do you have the electricity? Do you have enough power in your electricity? Does the device need your electricity 24 hours? What about medical gas? What about water? What kind of water? What kind of gas? Different things like that you have to make sure will work in the facility. Now, ways you get answers to that is you get the specifications on the equipment, you ask other engineers, you ask architects who help build your building. They typically know the answers of what your building can support. Going on, before you accept the equipment, is it patient ready? In other words, is it ready when it shows up at your facility to use? A lot of times the donations are not patient ready when they're offered. Well, that's a no. Can it be made patient ready? Well, if that answer is yes, you need to make sure those steps are in place before it gets shipped to you. If there is absolutely no way it can be made patient ready, that is a time to stop. You can't move any further. Well, once it's patient ready, the next question, is maintenance service available once you get it? Now, that could be you have somebody in-house who works on it. It could be a trained biomed at another facility. It may take a day or two, but that's still available. Now, if it's not life support and you don't have a backup, it's okay if it takes a day or two. If it's life support, you need to have maintenance service or multiples of that equipment on standby in your facility. Now, if there's no maintenance service available, you stop and figure out what it takes to make it available, and that has to become part of your plan. Once it's a yes, next thing is clinical training available? Not just once, it needs to be on a routine basis. If the answer is no, again, it's not a stop. You have to address that question to make arrangements to go forward. And if we could go to the next slide, we'll have Marie-Claire do the quick translation on this one.
I'll do the translation.
You'll do it? Okay.
Go ahead, yeah, go ahead, Evanel.
I was following you with attention. So, ça n'a pas le fait, on a fait un résumé de tout ça David a expliqué là. Donc, le sujet principal David là, c'est qui gens l'hôpital yo gain équipement médical que a servi. C'est-à-dire on a parlé de acquisition. C'est-à-dire qui gens l'hôpital gain un équipement qui vient la caille. Donc, l'hôpital a un équipement, soit c'est acheter équipement ou bien soit c'est un don, l'hôpital a recevoir équipement. C'est façon ça l'hôpital a un équipement. Mais maintenant, et généralement, nous recevons équipement ou en don, Donc, parfois, ils ne pas venir correct. Et nous avons un ensemble de questions pour nous poser à chaque fois que nous offrons un équipement médical ou bien nous achetons un équipement médical. Premièrement, est-ce que l'hôpital ça nous a besoin d'équipement ça vrai? Ou bien est-ce que il pas besoin d'équipement ça? Et si nous avons besoin, combien nous avons besoin là-dedans? Parce que généralement, c'est important pour que à chaque équipement qu'on gagne, ou gagnons l'autre en backup, au cas où on a tombé en panne. Donc, question ça, il faut nous poser. Et l'autre question, et l'autre paramètre, David touché encore, c'est que c'est question de décision qui l'aime doit accepter un équipement, à qui l'aime pas doit accepter un équipement. Donc, c'est-à-dire, nous avons besoin de une phase côté pour nous dire non, ou bien côté nous dire oui. Généralement, depuis que nous dit donc tout le monde a tendance pour dire oui, n'a point. Mais parfois, il est demandé pour que nous décidions, pour que nous réfléchissions, pour que nous disons non. Parce que on prend le cas, par exemple, nous avons une question de l'environnement. Par exemple, au cas d'un équipement qui demande un courant 24/24. Donc, si nous avons un équipement qui nécessite un courant 24/24 et que nous connaissons en Haïti, donc nous ne pouvons pas avoir un courant 24/24. Donc, si y a un équipement comme ça, donc il faut me décider pour me dire, là, je vais dans le stade pour que je me dise non, je ne peux pas prendre un équipement ça. Ça, c'est une phase. Maintenant, l'autre question pour nous poser encore dans la question de recevoir équipement, donc il faut nous faire sûr que l'équipement est prêt pour utiliser sur un patient. Donc, est-ce que nous avons un système de maintenance ou bien en place au niveau de l'institution de santé qui va permettre que nous vérifier, ou bien nous tester l'appareil pour nous s'il est OK, ou bien est-ce que c'est un technicien biomédical qui est dans l'autre institution de santé qui vient checker pour rassurer que l'équipement est en panne. Ça, c'est un. Deux, dans l'acquisition d'équipement encore, il faut nous tenir compte de services de maintenance. C'est-à-dire, est-ce qu'il y a un service de maintenance qui est disponible pour le type d'équipement que nous avons recevoir? C'est-à-dire, est-ce que ce type de service est local ou bien en dehors pays? Donc, c'est ce type de question que nous avons besoin de poser généralement avant même de faire acquisition d'équipement. Acquisition d'équipement, soit c'est en don ou bien c'est l'équipement qui est acheté. Donc, moi, c'est ça, c'est pratiquement ça, il est un petit peu englobé tout ça et généralement tout ça, David s'est expliqué là.
Okay, now, once they finished with all of that, there's still a few more questions to move on to.
Donc, quand on finit avec ça, donc il y a quelques questions que vous êtes capable de venir avec nous.
One of the big ones, if you're going to have maintenance,
donc est-ce qu'il y a une maintenance qui est disponible?
Is biomedical training available for somebody in-house or somebody nearby?
Est-ce qu'il y a une formation qui est disponible en biomédical, soit pour un technicien qui est dans l'hôpital là, ou bien pour l'autre technicien qui est tout près?
If it isn't, you either stop and you arrange that training.
Et si à ce moment-là, pas de ça qui est disponible, donc à ce moment-là, j'ai un signe de, ou j'ai scampé pour dire non, à ce moment-là, pour que nous soyons capables de programmer, pour que les formations, les gens qui sont formés à ce niveau pour capable de prendre des décisions ça.
Or if there is no way you can get biomedical training, maybe that piece of equipment's not appropriate for your facility.
Pas aucun moyen pour que nous ayons formation pour l'équipement que nous avons recevoir. Donc, à ce moment-là, pas aucune nécessité pour que nous acceptions un équipement comme ça.
And then one of the most important questions is, can the facility afford the cost? And it's not necessarily just the cost of acquiring the equipment. It's the cost of keeping it running, maintaining it, and having the supplies they need.
Il y a une plus grosse question que nous avons besoin de poser, c'est est-ce que l'institution de santé ça lui-même gagne assez de moyens pour que pour l'équipement ça il toujours à marcher. C'est pas coût en termes d'acquisition pour acheter parce que généralement c'est pas yoboli, mais cependant est-ce que l'institution de santé ça il gagne assez de moyens pour qu'une machine ça marche pendant toute durée de vie machine là. Est-ce qu'il y a assez de moyens pour acheter tout matériel que machine ça a besoin d'utiliser en général pour maintenance machine ça?
And one of the ways to help control those costs is through standardization. Is this new piece of equipment standardized with other equipment either at your facility or nearby facilities?
Et une façon qui est capable de permettre de réduire coût ça c'est à partir de c'est à travers standardisation. Standardisation, c'est-à-dire au niveau de l'institution de santé, donc on a un équipement qui est même qualité. On, par exemple, si on a une pompe à succion Choco, on connaît l'hôpital a 5 pompes à succion, donc toutes 5 pompes à succion c'est Choco. Donc ça permet que nous conserver moins de pièces, parce qu'on pas plusieurs pièces pour plusieurs marques différentes. C'est ça, vous parlez de standardisation.
Now you can imagine how much easier it is to keep the supplies, keep the repair parts, train the people on equipment when it's standard with other equipment, either at your facility or others. If it isn't the standard, will it become the new standard moving forward, and it's the only one that you acquire in the future?
Donc, vous pouvez imaginer comment ça beaucoup, très très facile. Et puis la permettre de gestion maintenant c'est fait très facile parce que vous avez tout équipement qui même modèle, donc ça permet que vous avez pièces pour pièces pour un seul modèle au lieu que m'a gain pièces pour plusieurs modèles différents.
And the very last question, which is extremely important because if you don't have the supplies, you can't use the equipment, is are the supplies readily available, but you also need to think about the cost of those supplies.
Et il y a un bagage pour que nous porter attention, c'est que si automatiquement que nous pas de matériel pour équipement utilisé, donc c'est que le matériel ça vient pas utile ou rien. Donc ça veut dire à ce moment-là, il faut analyse faite pour nous connaître si nous avons besoin de matériel pour appareil ça utiliser, est-ce que le matériel ça est disponible? Parce que si il n'est pas disponible, c'est que nous n'avons pas aucun besoin pour matériel ça dans le niveau institution.
Now, each one of these decision blocks that in yellow will have a whole bunch of detailed questions that you'll have to think about to answer this question that's in the box. We do have a handout with a bunch of detailed questions, but you can add more, use the ones that make the sense. But at that point, once you've gotten through all the yeses, it's time to get the equipment.
Donc, si nous regardons les slides qui sont passés là, donc nous voyons toutes les questions qui sont pratiquement en jaune. Donc, si nous voyons arriver en non, si nous voyons réponse c'est non, donc ça c'est période qui montre pour nous dire non, nous obligés de camper, nous ne pouvons pas accepter l'équipement ça. Mais si réponse c'est oui, pour nous prendre l'équipement, donc c'est là qu'on n'a pas besoin de poser toutes les questions que nous sommes parlé tout à l'heure.
Okay, thank you so much, David and Evanel, for going through this process. I think it seems like a long process, but when you think about the reality of what it means to spend money, time, and effort on getting equipment and getting the wrong thing, it's definitely worth doing your work at the beginning to prevent the problems at the end. As you were talking, both of you, David and Evanel, I was really thinking about Carl Eugene, because at the end you got to the importance of standardization and the importance of being able to find all the disposables and things like that. And so I'll have Mary Claire translate briefly what I just said, but then turn it over to Carl Eugene to share a little bit about what you're seeing in country and maybe sharing some of the advantages of providing things in country. Obviously, those disposables being ready available is huge. So go ahead, Marie-Claire, and then we'll turn it over to Carl.
Merci, Evenel, avec David, parce que nous partageons information ça yo. Peut-être information, question yo, processus là paraît un petit genre long et compliqué, mais vraiment, on a pensé à tout l'argent avec temps, à toute énergie, nous mettons dans voyer un équipement ou bien dans acquisition un équipement, et puis pour t'arriver pour que tout temps ça, tout l'argent ça, ou investir dans un équipement qui ne peut pas marcher, ça a créé un vrai problème. Et passer avec M. Carl Eugène qui pourra le faire exposer par là dans la question dans l'équipement que le gagne, lui-même il a nous plus une idée claire nan, surtout dans la compatibilité avec standardisation équipement yo. Alors, nous pouvons le donner tout de suite à M. Carl Eugène.
Yes, hello everyone. Thank you, Barbara, for putting this together. Thank you, Ozias and David, because the information you gave was really important. And this is something I'm fighting like over the years to see how we can standardize the equipment and also access. We need better access to parts. We need to find parts. We need access to bring them in Haiti. And before we get there, the most important thing is maintenance. What David and Evna was saying there, that's the first part that we really need to focus on. Because when you get an equipment in Haiti and something is wrong, and you're trying to go everywhere around there trying to find parts, it's becoming a problem. If we could prevent that from before, it'd be less problems. So maybe I should translate in Creole, right?
Sure.
Yes.
Yes. Ça m'a dit merci à Evnel et David qui t'ont porté et tout point ça qui était très important dans l'affaire médicale, dans l'affaire l'hôpital, dans l'affaire clinique en Haïti ou même n'importe qui côté dans le monde parce que l'autre point équipement vient avec avant que nous arrivions pour nous problème avec pièces avec accès pour nous gagner pièces rentrer dans le pays, puis gros problème c'est maintenance. C'est comment nous va préparer pour nous pas quitter ça arriver dans point ça et ou bien si nous veulent pas arriver dans point ça comment nous pas accéder pour nous joindre pour nous joindre pièce pour nous pas arriver mal parce que un équipement qui était là nous pas une pièce pour nous ranger il vient créer frustration docteur pas qu'à travail et l'hôpital là bloqué si un patient vini et puis c'est lui pour sauver il vient créer un problème. So c'est ça que je voulais remercier David avec Evna qui t'a monté point ça yo que même prendre note de bagaille que je même voulais que me prendre de yo pour me améliorer de côté PAM. In English, I wanted to say thank you to David and Evna because I even had some notes from what they said to better my system in Haiti to see how I can really help my community. So that's one of the biggest thing that we really need to work on, and that's what I wanted to say.
Thank you, Carl. Appreciate you sharing, and because you have so much firsthand experience with supplying equipment there in Haiti. And for those of you looking for different equipment in Haiti, Carl's business is in Port-au-Prince, and I know you do a lot of work up in Cap Haitian as well. And it is on the Relink Global Health database, along with many other great Haitian businesses that are supplying equipment. Next, I wanted to go over to Rick and ask
quickly on that.
Oh, sure. Go ahead, Tom,
I was
please.
just going to say that one of the issues is a lot of the groups from the States and other places that are sending equipment down don't always have a biomed looking to see is the equipment appropriate. And that's one of the big problems, you know, though even some of the bigger groups, I've seen them they need an incubator, they go online and they find one made in China for $5,000 and they buy it, but there's no manuals available for it. Getting parts from China is not always easy, and it's a big problem where they really, I don't know how we reach out to all the groups that are out there and say, you know, you need to think about these things, but that's one of the biggest issues I see a lot down there.
Donc ça tombe expliqué c'est que il y a un plus gros problème que nous gagnons avec un groupe ou bien individu qui a payé équipement dans l'institution de santé, c'est que pas vraiment un technicien biomédical qui garde l'équipement ça pour est-ce c'est des équipements qui appropriés même avant que vous voyez en Haïti. Donc on a juste arrêté donc là aller en ligne et que par exemple si on a besoin d'un incubateur par exemple, les juste aller en ligne, il y a un incubateur qui coûte pratiquement $5,000. Donc, pratiquement un fabricant capable en Chine. Donc, juste ordre et puis vous voyez le venir. Donc, ça qu'on arrive dans le cas, donc, pas aucun service de maintenance qui est disponible pour type d'équipement. Et c'est un problème, c'est un plus gros problème que lui-même, qui fait face à lui assez souvent en Haïti.
Yeah, thank you so much. And we have a really good comment that came in that I think goes right along with what we're talking about right now from Mr. Bob Downey, who's one of the participants. And I'm gonna read his comment here, but I also want to encourage everybody to use the question and answer. Type any questions you have, any comments that you might have. We welcome that. This last 30 minutes is definitely, I hope, going to be some more discussion. Rick, just to cue you up, I'm going to have you share a little bit next about some of your experiences with Haiti and also your work with tech. And it's on this topic that I'm going to read this comment about. So I think it'll tee you up next to share a little bit, Rick. But Mr. Downey's comment is, I think it's very important considering when evaluating potential equipment donation is that the product is getting near the end of its sales and support life. And I think that is an excellent point. I know here at the Dalton Foundation, David does an excellent job of thinking through this, and we will not send anything out that we know doesn't have about 5 years left of good life in it. It might be used. We might have the ability to make it patient ready, but do we think we're going to be able to keep it running for, at least 4 to 5 years? And then to continue on Mr. Downey's comment, he adds that some vendors, which we would agree with completely, are willing to donate these older types of products, but you need to consider how long you'll be able to use it and whether any of the consumables which you need to make it work are still available and for how long. And I mean, that's a really huge point. We're going to go through some case scenarios here in a few minutes, and I think we'll touch on that a little bit, but I just wanted to bring that up now because I think that's something we tend not to think of all the time. So,
Hi, Barbara, can I address that just real briefly?
sure.
That is something that we at least we do here think about, is just because it's at the end of its sales or support life doesn't mean it can't. We look at, can it be used for 5 years when it goes down? Now, if we know repair parts are going to be scarce, what we will do is they need 10 patient monitors. We basically know that 1 or 2 of them is going to need a repair roughly every year. So if we send 10, we're going to send an extra 5 or 6 parts units with it, completely working with all the good parts. And we'll keep touch with them to where if they're using too many parts, we'll go find other units to send down as parts units. But the big thing is with the consumables, if there are more than just the manufacturing, there's third parties, non-OEM consumables available, typically those will be available much longer. Same thing goes for repair parts. The big thing is, when we're looking at this, we look at the entire market of what's available currently, and from experience, you just know that if there are 6 manufacturers making the supplies for this device that's going out of service, there's a very good probability one of them will still have the supplies 5 years from now. Thank you.
Donc ça veut expliquer, c'est que non seulement travail, même ça offensé travail que vous faites au niveau de RELEC en Global Health. Donc non seulement vous tenez compte comme si et quantité en durée de vie équipement, mais vous tenez compte également sur disponibilité et par exemple au cas où vous avez une pièce de rechange qui n'est pas très rare, vous tenez compte par exemple si nous avons un moniteur cardiaque. Donc, ça vous fait, c'est que vous voyez, à part de unité, vous voyez qui a marché, vous voyez 3 ou bien 4 accompagnés de stock que vous voyez, que vous êtes capable de considérer comme ça en pièce de rechange. C'est-à-dire au cas où il y a un problème, et si nous avons par exemple un moniteur patient, donc vous estimez que donc ça a une panne entre 1 à 2 ans. Donc là, ça, il y a bien un qui est là, qui est capable de prendre pièce et puis pour capable faire réparation. Donc et là, il parlait de si tout dépend de fabricant et tout, si on parlait de consommer par son plaisir, c'est-à-dire matériel qu'on utilise pour équipement. Donc il tenir compte qui quantité l'autre compagnie qui fait et matériel consommable ça et tout. C'est-à-dire, le corona, dans le temps, soit dans 4 ou bien dans 5 ans, si nous avons 6 compagnies qui font matériel consommable pour le même type d'équipement, donc on connaît dans 5-6 ans, même si 3 ou bien 4 pas dans business encore, mais au moins, il y a 2 qui étaient comme ça capables de joindre matériel consommable pour faire machine ça marcher pendant la durée de vie machine.
Great, thank you. We're starting to get into some of these good points that are really important as we're going through. So Rick, I wanted to turn it over to you. Hear for a little bit of your perspective of what you've heard so far, and maybe share a little bit about the work that Tech does with trying to prevent a lot of these poor donations from being made.
Okay, well, I appreciate the opportunity. I've actually been doing this for about 30 years, and I think in addition to all over Haiti, I've worked in about 30 other countries. And so the stories, needless to say, the stories are long and very sad, because in most of the limited resource world, there's a kind of an urgency to just get what we can quick and what can we find cheap or free. And that has resulted, unfortunately, in just a lot of sad stories of inappropriate procurement or receiving of equipment that doesn't work. And the World Health Organization, as you know, has statistics that show that. It's a very, in the long run, it actually costs more. And as you already mentioned, Barbara, it also wastes time and money and results in a very frustrating thing. So that's a high elevation thing. So what's important is, and I really appreciate what Evnil and David has shared, what's important is that the hospital or healthcare management people understand these processes and procedures that Evnil and David both discussed, and not only understand them, what's important is that they apply those and they actually put them into practice. Again, the tendency is, what can I find quickly and what can I find cheap? And they don't ask the questions that David has shown, and the result is inappropriate transfer of technology from one country to another. And just to mention Tech, so Tech was founded about 30 years ago for the purpose of trying to help the organizations that provided medical resources to the majority world, help them understand, what is really appropriate and how do we do this correctly. If our goal, and it should be, especially as believers, our goal should be that we provide quality and safe health care. Providing inappropriate technology and is what Tech calls junk for Jesus does not result in safe or quality health care. Matter of fact, it can be dangerous and quite the opposite. So the Tech was founded and developed the standards, and I think, Barbara, you're going to share that with the recipients.
Yes,
some standards and standards to follow.
French.
Yeah, standards to follow, things to look for, and there are similar questions which David has already included. For example, the standardization, the importance of standardization. We won't go into all that now, but if you follow these standards and you look for organizations, and so Tech is an association of a variety of organizations that work in international healthcare. And so the goal is to help them improve, educate, help them improve the quality of that healthcare, work together, and so also get to know each other. And so the recipients need to know who can they go to trust that they can ask these questions, and that the provider of healthcare technology will be is concerned and will seriously provide what you really need and what you're asking for, not just, well, I have this available, or I'd like to sell this, and don't really consider the end user and what they really need. That's kind of my high elevation thoughts. There's a lot of stories to go with those, but I guess I'd leave it for any specific questions you might have to go with that.
Donc, Jean-Ric s'est expliqué là, donc peut-être n'a pas le cliqué pour nous poser des questions, mais ça qui est expliqué, donc il y a pratiquement 30 ans que l'a voyagé à travers Haïti, presque dans 30 autres pays encore, dans les pays sous-développés, parce que les mêmes c'est directeurs exécutifs, ils ont une organisation biomédicale qui travaille dans le système de santé. Et donc, c'est tout type de questions, de processus que moi-même avec David nous avons expliqué là, Donc, c'est pas seulement, c'est pas seulement et, comprendre ça, nous sommes expliqué là, mais c'est d'avoir implémenté, c'est-à-dire appliquer ça moi-même, et Venel et ça David sont expliqué en termes de maintenance, gestion de maintenance, etc. Donc, ils comprennent que ça a soulevé l'autre question et même l'Organisation mondiale de la santé, il y a des statistiques qui montraient différents problèmes qu'ils rencontraient, surtout quand ils prennent des décisions, qu'on décide et ils ont besoin de très rapide ou bien ils ont besoin de qui coûte bon marché. Donc, nous connaissons dans côté bon marché, donc nous pas à la fin à qui ça, à qui résultat ça va déboucher, qui finalement qui va payer les conséquences. Donc, grosso modo, c'est un résumé de ça, Rick sautait parler.
Thank you. Thank you, Evanel. And thank you, Rick, for sharing. I think the perspective you bring from all your experience in all your different countries is invaluable. And the work tech does is very helpful in preventing and stopping a lot of the poor donations that have happened over the years. Can everybody see my screen?
Yes, I can see it.
Okay. As soon as I click on something, it seems to go away. But we have a few scenarios up here, and these are all real life. These are real stories. Obviously, getting an X-ray is an easy one, but I mean, some of these are real life things that we've had come to us even just recently. I'd like to just keep this as a discussion, maybe looking at the first one. I think it's common to look to expand to offer X-ray services. For anyone on the panel, what would you offer as some of the key things? They really need to go through the whole checklist, but what are some key things that you would suggest that they think of?
Are they going to develop the X-rays? Is it going to be filmed? So they need to figure out how much chemicals will cost for the year. If they got a CR machine, you know, figure out how much it's going to cost them in cassettes as they wear out. There's a lot of ongoing costs with trying to expand a new service, as well as maintenance costs for them.
With X-ray, you have to look at safety and your lead shielding. Where are they going to do the X-rays if they're expanding it? Is the facility ready for doing the X-rays?
Pour question de radiographie, donc Tom l'a mentionné, et comme si un coût de maintenance tout au long et tout au long durée de vie machine là. Et David lui-même est passé pour parler de question de sécurité. Par exemple, si nous avons une machine radiographie dans l'espace, il faut nous tenir compte de est-ce que pour question de gestion rayon, donc est-ce que son chambre qui est protégée, est-ce que toutes les mesures de sécurité sont en place?
Some of us are really advocating going to portable X-ray systems that are digital versus, you know, trying to get the cost and the installation of large X-ray systems, especially that require film and processing. I think, matter of fact, I think Megan from Peridot is on this webinar or tuned in, and they got a really nice portable system down there. It's cost effective. You can use it in really remote places with low power. There's a lot, and of course it's digital. You don't have to worry about film. There's a lot of advantages of seeking to go with portable. Some people think bigger is better and they need to have a fancy X-ray system. But especially if you're in areas where you don't even have X-ray, portable is really one of the things that should be considered.
I would agree with that, especially with the power issues with unstable power or not enough power, overtaxing the generators. The portables are the power supplies in them are pretty robust, and basically every machine's running off the batteries all the time. Yeah. The only issue I see with the digital is that the cost of the flash pad or whatever they're calling it on that
detectors, yeah.
Yeah, it can be very expensive, and a few drops and they stop working sometimes. So that's the only issue I see with the digital. The CRs are pretty good, and you can keep the cassettes going for years without problems a lot of times, but it's just more equipment to maintain as well. But it's definitely a big step up from film.
Yeah.
Un point que Rick a plus voté sur question de nous avoir un système X-ray portatif au lieu que nous avons un système radiographique qui est en place. Et résultat va simple en termes de coût. Et l'autre paramètre encore, c'est que en termes d'électricité, tout, par exemple, nous connaissons en radiographie portatif ou même fonctionner sous batterie. C'est un environnement côté que nous avons un problème courant tout le temps. Donc, vous connaissez depuis en radiographie portative, les batteries rechargées, donc on soit capable d'utiliser. Et on peut utiliser un système digital également. Par exemple, nous avons un CR cassette. Donc, on peut utiliser. Et ça, laisse pas besoin d'inquiéter pour connaître, on a besoin de film, tout le temps, on a besoin de film, etc. Donc, c'est ça qui a un avantage entre une radiographie portative avec un système de radiographie ordinaire que nous connaissons.
These are all
And,
great points.
Comme les mêmes saletés avancées, c'est que notre problème qui compte dans le portatif, c'est que si tu vas arriver en panne, c'est que pièces qu'on a déjà cher. Peut-être que ça va seulement ça que tu as comme problème, mais cependant, si puis gros maintenant ce qui gagne, c'est remplacer batterie pratiquement chaque 5 ans.
don't forget that if film and chemicals are available in country, from what I understand in Port-au-Prince, it does make an effective backup. All you need to develop film are the trays, a timer, and a darkroom. You don't necessarily need a machine. You just need somebody trained with the tongs to manually develop the film, because it's not if the digital's going to go down someday when you really need it, or the CR reader, it's a matter of when. So you just need to know what your backup, and film is always a good backup, but you have to have somebody trained to develop it.
Donc, point de vue, David, à côté là, c'est que généralement, on a toujours besoin de backup. Et qui ça n'a imaginé pour que nous ayons comme backup au cas où nous avons un système digital qui t'a tombé en panne. Donc, il parlait d'un processus manuel. Donc, automatiquement, il y a un produit chimique et un produit chimique qui est disponible en Haïti, comme ils connaissent ça, existe pour le Port-au-Prince. Donc, seulement, il y a besoin de gens qui sont formés, qui connaissent, qui sont capables de développer film manuellement au cas où, parce qu'on va contre qui leur, ou un système digital là qui est tombé en panne. Donc, il y a seulement besoin de gens qui sont formés et puis qui connaissent qui gens ça fait. Donc, on n'a pas besoin de machine, effectivement, pour capable faire. On n'a pas besoin de développeur, vraiment, pour capable développer film. Seulement produits chimiques avec une chambre noire, et puis il y a des gens qui sont formés, qui connaissent qui gens et sont capables de développer film manuellement.
And if I'm correct, Carly, you have placed quite a few portable X-ray machines around Haiti, correct? Like, I know that's something that you guys are pretty skilled at with your workers and placement, correct?
Yes, we sold a few in the country. They're really good, you know, because like they just said, they use batteries and not a lot of power, so you can recharge them. You need actually film and everything, but they are not giving any problems. So it's a good way to go.
Good, thank you. The next case scenario we have up here is one that we've personally dealt with as we have been working to standardize patient monitoring in the northern part of Haiti. A little background, we did ship in a lot of monitors into northern Haiti and standardized 7 different hospitals in the region, all on the same monitor. And Evanel did those installations for us, and we're getting some good feedback on that program. We think it's really important. One thing we saw when we did the inventories was one hospital, for example, that had, I think they had about 10 or 12 monitors already, but they had 5 or 6 different manufacturers of those, of different manufacturers. Made it very difficult for staff, made it nearly impossible to keep parts to repair. It was a huge challenge. So I know that was one we dealt with personally. To everybody on the panel, what kind of suggestions would you offer in addition to standardization for people considering patient monitoring?
Where are they going to put the monitors? That's something that's not thought of a lot. Do they need a roll stand for it? Can they mount it on the wall? Because I see a lot where it just gets balanced on a shelf or something, and you end up having just lots of damage due to things falling down. You know, they move a stretcher and it pulls the cable down. So, I mean, that's something that's not always thought of when they say we need patient monitors. They get 10 monitors, but then where are they going to put them and how are they going to mount them?
With patient monitors, understanding the clinical need and clinical use is very important because there's many different parameters and actual critical levels of the patients that they may be monitoring. For example, general surgery, usually you don't have to monitor end-tidal CO2 after surgery. If they're doing anything with the heart or lungs and certain other cases, they a lot of times want to monitor end-tidal CO2 post-op in addition to your pulse ox, which they would monitor anyway.
Et pour nous faire un résumé, c'est que Barbara a parlé de question de standardisation et il parlait de pratiquement un série de moniteurs cardiaques qui ont été voués en Haïti et on travaille avec pratiquement 7 hôpitaux. Et mais le problème que vous fait face à lui, c'est que quand vous arrivez dans l'hôpital qui gagne pratiquement 6 à 7 moniteurs cardiaques, mais il y a des fabricants différents. Donc ça pose un petit problème dans la question et utilisateur, par exemple, infirmière, donc il est obligé d'apprendre chaque moniteur, il est obligé d'avoir un apprentissage séparé pour chaque moniteur, parce qu'il n'est pas de même qualité. Donc, quand ça a été c'est le moniteur cardiaque que tu vois en Haïti, donc il y a l'hôpital Pignon qui gagne en catégorie, donc c'est Philips, et puis nous avons l'hôpital Fort Liberté, Wanamet avec tout du Nord, et c'est moi-même qui ai fait l'installation. Maintenant, tout de suite après, Tom Monaghan parlait a intervenu pour parler. Et c'est vrai, standardisation avec un moniteur cardiaque, c'est bon. Mais cependant, les recevoir un moniteur, ça vous connaissez qui genre, vous pas le monter. C'est-à-dire, est-ce que c'est dans le mur, il y a météo, est-ce que c'est sur un étage, il y a météo, parce que généralement, ça a le plus gros problème qu'on fait face à lui, c'est qu'on conjoint un moniteur. Si c'est son étage de météo, qu'on sortir tomber et au cas et c'est des appareils qui coûtent cher, donc c'est va tenir compte de sécurité, c'est-à-dire une fois que l'hôpital a recevoir, donc c'est qui gens il va le faire pour capable de sécuriser le moniteur pour que il pas sortir sur étagère pour capable tomber à terre.
And I'm looking at the time, and I'm happy to stay past 1, but I just want to respect everyone's time. We do have a few questions that I wanted to maybe address as we go on. Megan, who you did mention, Rick, is on. Their X-ray machine is the Batteray. Megan shared that with us that they have at their hospital. I know the AMX4 is another one that's commonly used successfully in Haiti. If anyone has specific questions, we can certainly answer those one-offs and connect you to any of the panelists going forward. Dr. Kaplan put in an interesting comment that I think we need to address before we run out of time, and that's the topic of sterilizers and newborn incubators. I know those aren't related, but I know those are 2 critical pieces of equipment that are often mispurchased, I guess is the word. There's a lot of mistakes that happen with those. Could any of y'all or all of y'all on the panel comment about some things to consider, I guess, first with purchasing and procuring sterilizers, and then we'll go on to incubators?
I'm got to be hesitant what I say here. There's one provider of sterilizers that I see these all over the world, and there's many in Haiti. They're very large. They require a lot of power to operate them, and they're very high maintenance. Sadly, most of the world does not maintain those, and so they're in rough shape. The tendency or trend nowadays is to try to, although it's a little bit, initial cost is high, raise the money, find the money to purchase better quality portable sterilizers. And you can get portable sterilizers with good sized chambers that will actually support surgery, some surgeries. Not maybe orthopedic because that requires a lot of instruments, but but some surgery. So I would be hesitant to recommend really large sterilizers now. And if you've got those, you're probably experiencing the difficulty of keeping them maintained. There are some of us that have been trained or know how to service some of these large sterilizers, but you might want to be planning and budgeting for replacement and going towards a large tabletop sterilizers. One of the ones that are popular with a lot of people now are made by Tutenauer. A lot of people call it Tuttenauer. Tuttenauer, Israeli made, very good quality sterilizer that does have a large chamber and also can be purchased in a manual, with manual controls, so you don't have to worry about electronics or anything failing or being susceptible to power. So those are some recommendations that I would give.
Just to
for
chime
larger
in on
ones,
the hour, you
I was
can
gonna
buy
say for larger ones,
the
Health and Crane makes one. I can't remember the model number of it, but it's very large. But with all of these tabletop sterilizers, one of the big issues is what water are they pouring in it? If they're not using distilled water in them, or I mean, what I would have people to use down in Haiti was go to the store and buy the battery water, which was good enough quality that it would work in the sterilizer as well. But if they're not using distilled water or the battery water, the issue is they just get gummed up in no time. Even the tabletops won't last at all.
Right.
Donc, tu as parlé de question de autoclave et que Records lui-même a avancé pour dire que dans l'expérience, que des fabricants qui des autoclaves qui à travers Haïti. Mais le problème qui compte poser, c'est que ces gros autoclaves, c'est que vous boulez pile courant. Et lui-même, ça va voter pour lui, c'est ça va le tabletop, c'est-à-dire portable autoclave. Et il va recommander, il va utiliser Tuttenauer, qui pratiquement qui une chambre qui est plus ou moins appropriée, que va utiliser pour sortir. Et mon agent lui-même il a avancé pour dire que qu'il était un autoclave qui est très large ou bien qu'il était un autoclave qui est portatif. Et tout problème c'est chita sur qui de l'eau utilisé dans l'autoclave. Par exemple, nous connaissons généralement tout autoclave est supposé utiliser eau distillée pour capable servir avec eux. Mais parfois, nous utilisons de l'eau batterie, même s'il n'y a pas la même qualité avec l'eau distillée. Donc, si vous n'avez pas utilisé de l'eau, vous avez utilisé de l'eau, c'est que donc, tout au long, et machine, donc la tombe en panne très rapide.
Someone mentioned Midmark, and I would agree. Midmarks are great sterilizers. Unfortunately, they over the years they stopped manufacturing their mechanical sterilizers and are gone to the automated. And some of their models are very susceptible to power. And so I've talked to Midmark, and they are addressing that, and they're trying to change and make one that's more appropriate in environments that is susceptible to power fluctuations and problems. But it's hard to find their old mechanical ones. If you can, get them and find the spare parts to keep them going, because they are good quality sterilizers.
Donc, pour dire qui mentionnait Midmark comme modèle, donc c'est très bon modèle, mais cependant, il y a un petit problème dans la question, il est très susceptible à fluctuation de l'électricité. Donc, lui-même, il parle avec mon Midmark, donc il a pour changer et il a pensé à un changement pour que, suivant l'environnement que la machine a, pour que les capable d'adapter à la situation électricité qu'il a bien. Mais de toute façon, c'est une très bonne qualité et Midmark et tout.
Hey, thank you. What about incubators? What kind of advice do you give to people considering purchasing, starting a NICU or expanding those services? I know that these could actually be quite dangerous or deadly if not done appropriately.
Let me just jump in and say, I agree with and I like what Tom said about sterilizers. doesn't matter which one you get, the quality of it, if you don't know how to use it and use it incorrectly, you've got a problem. The incubators are really susceptible to this. I've seen throughout Haiti, I've gone to hospitals where they say our incubator doesn't work. And in fact, it did function correctly. There was just an operator or procedure errors and not knowing how to use it, which results in some sad stories. So the biggest thing with incubators, I think it's very critical that staff, not only was Evan already pointed out, you manage that technology and it's maintained, but your staff are trained well on how to use them.
Donc, Rick Wood lui-même, il parlait, il dit que Tom Managante a un très bon point sur la question en autoclavio. Donc, quelle que soit la qualité ou bien quel que soit le macotage, c'est pas trop important, mais la question, c'est qui vont utiliser de façon correcte. C'est-à-dire, si on mal utilisé, donc c'est sûr que la tombe en panne. Donc, l'État va aller dans le même sens avec un incubateur et que lui, à travers Haïti, tout.
I'd agree with what Rick said about the incubators and getting the staff trained properly. It was always a battle almost everywhere I went to get them to use skin probes and use them consistently as opposed to just setting the temp to the air probe on the warmers and on the incubators. Also, there's a lot of these China-made or India-made incubators in different places in Haiti that they need a transformer to plug in because they're made for 220 volts and it's almost impossible to get parts for them. But I mean, what happens is they look for incubators and they find they can buy these incubators brand new for $5,000 or $8,000. And if they look at an incubator, new incubator from the States, it's $50,000. But it's just a matter of convincing them that if they buy a 10-year-old incubator from the States, we can keep it going for 10 years, while the China one, once it breaks, it's almost impossible to get replacement parts for it.
Supplies are a huge issue. The skin probes that Tom brought up. That's why with infant incubators, it is highly recommended that they standardize not only at their facility, but across other facilities, because keeping those skin sensors available in country so they actually will be used, they are not inexpensive. They're disposable and they are fairly expensive. So it's very important to try to standardize across several facilities, especially if you only have one or two at your facility. You just can't afford to spend $1,500 on a box of 20 or 50 of those skin probes at a time if it's only your facility, whereby if you have a whole bunch of them, when you buy more probes, the cost goes way down.
All right, guys, thank you for the great answers. I think what we're going to do is look at the questions here. We're going to wrap up here in a few minutes, but we can keep the discussions going online. A quick question, because I've had problems. Is my screen still showing?
Yes.
Okay, I just want to make sure, because we are going to do quite a bit of follow-up after this webinar. We do have some good materials. I know Tom sent over some manuals that can be shared. We've got the handouts to share, so we want to make sure that we get this to everybody. Marie-Claire, there's one question in the question and answer box that's in French. Would you be able to read that one to us? And so that we can get that one answered? You're muted.
Yes, the question is from Gregory Alexander. Thank you for this great presentation. What I would like to know is it possible to make donation with an institution, parenthesis health provider, with the goal of making it sustainable and serve the community at an affordable price? Was that clear enough?
Not to me.
I think he's asking if they can charge patients for using the equipment. Evenel, is that what you're getting from the question as well?
I'm not a biomed, but I have worked in a lot of hospitals, and I've seen the ones that work really well have some a combination of fees that they charge, and I think, and most do think it's not unreasonable at all that there is a fee charged for the patients. A lot of the ones that I've seen around the world that work really well, those fees vary, and so those who can afford, would pay more, and those who can't, the hospital graciously charges very little or provides the service without a cost. But having fees for the service is certainly a need in its responsible business so that you can be a sustainable healthcare facility. So it's not unreasonable to charge fees for the service. How the hospitals do that, and they do it in a variety of ways, varies, but it's certainly a reasonable thing to do to be sustainable. I don't know if that answers the question or not.
Pour répondre question à Monsieur Grégy, c'est oui, il est possible que il y a un pile l'autre côté qui fait ça, qui fait patient payer puis utiliser équipement, et ça pourra dépendre tout de genre de service là et puis genre de gestion. Par contre, si ça répond à la question là, et puis tout, si vous t'étendez l'MT lire l'IA, est-ce que vous pouvez clarifier le plus? S'il pas répondre à la question que vous avez posée. Vous pouvez écrire dans notre chat là pour clarifier ou bien dans cette question.
Thank you, Mary Claire. And we lost Evanel for there for a minute, but welcome back, Evanel.
Yeah,
I think along with the question of costs, so there is another comment in here from Jocelyn that I think is another example of a story of just things to think through. She's mentioning that they have a HemaQ monitor that they purchased. It works amazing, but they've noticed that the micro cuvettes that they need to keep it working cost about $1.78 each. And the going rate for charging for that test is about 100 goods per exam. So you can see that they are losing money with every test they run, not to mention the cost of the machine. So all of these things are not insurmountable, and they're very common stories, but it's just really important to be aware of all those things before you make a purchase or a decision to expand services.
I see that a lot with syringe pumps that get shipped to different places where syringe pumps are large volume pumps that, the hospital says they need pumps, they ship them pumps, but then they don't realize that it's going to cost them $8 a piece for the tubing set. And are they still available for that pump even? So it is a common thing with the consumable costs isn't always factored in when the donation happens.
Yeah, you bring up IV pumps. There's one IV pump to get the tubing set into Haiti costs almost $20 a patient. Now, these IV pumps are all over the US coming out of hospitals, and they're trying to donate them. Well, a ordinary IV pump with the tubing set you can get in Haiti, you can buy the IV pump in Haiti for $1,300 roughly, but the tubing set's $2. After your 70th patient, it costs you more to accept that donation than if you had bought the other one up front. Now with the micro cuvette, or the micro Q and the cuvettes, if you had 10 facilities using that, I would bet you could start hitting the quantity breaks to get that price down at least 25% if you're able to buy them in sufficient quantities.
Okay, Thank you, guys. I mean, we've gone about 10 minutes over time. I know some people have had to drop off, but we thank you for everybody that has stayed with us. I do have this next step slides up here. Please contact us at info@Haiti Health Network with any other questions. For those of you that don't have any other personal emails, please reach out to us. We encourage you to use the database at the Relink Global Health database. Join the Haiti Health Network. I think these ideas that have been brought up, this idea of standardization is one we're actively working on in the North and looking to bring into the South next year. One topic which will probably be a future webinar is number one up here of establishing a medical equipment services company in Haiti. What would it look like to utilize the biomedical capacity in Haiti the best we can to share them amongst hospitals? It is a plan that I know we've talked to Tom about, we've talked to Evanel about, David knows all about it. We're looking to try to make that a reality in 2021. So these are some things coming up that we hope to be able to help with these problems that are so real. Then real quick, our next Haiti Health Network webinar will be September 17th, and it will be on cardiology services in Haiti. And we encourage you to join that or share that with any of your colleagues that may be interested. Evanel, can you in Creole do just a quick wrap up and thank you to everybody and summarize for the ending in Creole for us?
Oh, you want me to answer for you though?
Sure, or just end it in your own words is fine as well.
Donc, nous profitons de l'occasion ça pour nous remercier tout le monde qui était présent avec nous. Donc, nous avons déjà avancé pour 10 minutes, mais nous, quelqu'un est allé, et nous disons merci à tout le monde qui était resté. Et c'est une opportunité que nous jouons pour nous parler ensemble et discuter et de qui nous capables de faire gestion et des équipements biomédicaux en Haïti et pour bénéfice de toute la population, toute population. Donc, nous souhaitons que nous avons un prochain webinaire qu'a fait je crois que c'est le 7 ou
17 septembre.
17 septembre et nous encourager et tout le monde pour capable de rejoindre.
Okay. Any last comments from our panelists? Anything you'd like to say at the end? I'll give you guys the last word.
I would like to say thank you. It was we shared a lot of information. Thank you for everyone. I can't wait for the second one in September 17th. Je voudrais remercier tout le monde qui était là. Nous parler de bons sujets, nous prenons pile note et moi pas attendre prochain webinaire qu'a fait le 17 septembre. Très important.
Anyone else? All right, well, I thank all of you. Again, everyone, I know everyone is very busy. Biomeds are very popular. So I thank you guys for taking the time to be with us today. And we thank you to all the participants, and be looking in your email for the follow-up documents that we will share from this webinar. And everyone, have a great day.
Bye-bye, you guys.
Thank you.
Thank you very much. Thank you very much.